Hello, everyone. Well, three thank yous first before we start. Thank you for staying. I saw a lot of people when I was getting a coffee earlier, getting a few beers, but they're still here, so that's good. Thank you to Intelligent Health for this event. There's been some great talks this morning. As you're closing, sometimes you have to summarize a lot of this, which can be difficult. And also, I think, as we sort of close today, the main thank you that we should all be thinking about, and I think sometimes we get away from this when we talk about technology, is we've got to thank the clinicians, the caregivers, because this is about the patient. And sometimes we get too far away from that point. We focus heavily on the technology, we focus heavily on the evidence, but actually fundamentally everything we're trying to do is provide more insights to help to reduce the time to treat. I'm going to talk about a number of use cases today, talk about putting some reality on AI, but I'm probably going to talk about where I see the industry today, what people are doing and why, and how you can improve the overall benefits to health and care. I've also got an announcement today that just came out on the wire this morning about a partnership that we signed with a major Swiss university hospital, which I'll talk about in more detail, who have adopted Watson for Genomics. So again, very, very exciting partnership that we've started with them, and actually they're using it in clinical practice as well. I know that we've talked a lot today about the art of the possible. We've talked about what you could do if you had enough data, how you would train the systems. But I think really what I'm going to try and focus down on is actual use cases, where we've applied AI technology, what you need to do in order to get to applying AI technology. And I think, thirdly, I really want to focus on some real cases of environments and organizations that have actually done this. Now, before I do that, I want to look at the title at the top. So, what is AI? Fortunately or unfortunately in my role, that's something I have to talk about a lot. And people have used this acronym in many different interchangeable ways. And I think the favorite one for me at the moment is actionable insights. Because if I look at artificial intelligence, what is intelligence? It's a complex word. And then you talk about artificial intelligence, it makes it even more complex. So we talk a lot about augmented intelligence, so clinical decision support. But actionable insights to me is the key, and not just insights into the data and the volumes of data, and we talk about big data and cohorts and personalized medicine, but it's actually how do you action those insights once you've actually got that data? And that's really the goal. The goal is to get insights and to action on them. And then the other part of this talk is to benefit health and care. And I think, again, we focus on healthcare, but actually health is, my business is called Watson Health, not Watson Healthcare. But actually health is a state of well-being. So it's avoid of disease, and healthcare is actually the management and improvement of health by prevention, diagnosis, treatment, of disease, injury, or illness. So when you look at healthcare, which is really what we're aiming for, there's also consumer health, whereby I'm going to show you a video next of a lady called Michelle, who is a Medtronic employee that helped develop a Diabetic App. She's a person with diabetes is the right terminology these days, rather than diabetic. But she's type 1 diabetic. She helped develop this app linked to a glucose device. And it's a quick video for you to watch, but it will really show you the impact of the consumer health environment and how you can apply very simple AI to a simple issue in our everyday life. So let me just show you this first.
Dear Diabetes, since I was 9, you've been a part of me. You have impacted what I eat. You make me track my numbers. You make me, my family, my kids worry. The uncertainty of whether I am making the right decisions about you and my health never leaves. You're unpredictable and leave me guessing. But now, my phone, which I use to know the weather before it hits, get directions, and keep in touch with friends and family, has a new app designed to help people with diabetes like me. With the Sugar IQ Assistant, now I not only have numbers and data on you, but insights into what makes you tick. The Sugar IQ Assistant understands me, my life as a wife and mom with young kids, my passion for exercise, and my commitment to a job I love. And Sugar IQ with Watson technology actually predicts when I could have lows, so I can get ahead of it. With the Sugar IQ Assistant, I am now clearly smarter about you, diabetes. Yours truly, Michelle.
So why that's important, the light's gone up. Why that's important is this is a device that she uses every day. She's been using it since she was 9 years of age. Well, not the glucose device, but she's had type 1 diabetes since she was 9. Sorry, that's not a very interesting slide, so let me see if I can go back one. There we go. So we tested this with our partner, 600 cases, and actually in the end, by looking at all the data points, her inputting all the data about her diet, what she ate, actually was able to predict 3 hours before an onset of hypoglycemia. And for somebody that lives and breathes with this every single day, that's extremely important. So we can get to the enterprise provider environment, we can get to the payers, we can get to the large global pharma organizations that are in this room as well, but fundamentally this is somebody that's impacted, and a very simple solution for her that she uses every day, and we've got lots of people using this from a consumer point of view. So that's just one example of applying AI in a consumer environment, but really inside her own life and her own work. So, the million-dollar question, it's that. It's just everything. And I think part of the challenge of today, part of the challenge of all of these events, and I'd say 3 or 4 years ago when I took over Watson Health, these shows weren't really around, and people were actually coming to find out, is it real? Does it mean anything? Is this just another buzzword? And today is a great example of, it clearly isn't another buzzword. People are here now because they want to adopt this technology in many different forms. They're using their own terms to try and drive the market in a different way. But I truly believe if we don't believe more access to more information is beneficial, it's hard to move forward with this. And I say that because I'd like to go to the room for a second, because I think I did this about 3 years ago where I asked these questions, and I'd be interested to see what the same result is. So in this room today, whether you're an organization, a vendor, a provider, a payer, or whatever, who currently has artificial intelligence in their organization? I can just about see. So we've only probably got about 30 or 40 people. I had none, clearly, 3 years ago. So who is currently talking to providers or technology companies about adopting artificial intelligence? Okay, starting to rise. Who doesn't believe in it? That's great. We've got to turn these people around. And I agree with you, because there is an element of what is it, though? So we talk a lot about the evidence over eminence. A lot of the projects 2 or 3 years ago were eminence. They were about attaching themselves to an organization that is an eminent organization, doing research with them, and we have an app. But actually, we've found out over time that the evidence is the key. And actually building more and more evidence base and looking at democratization of health, which is really providing more insights to the research that's out there, the trials that are available, and actually augmenting the workflow of a caregiver or of a clinician. So, I want to make it really easy. So it's three things right now. Now, everyone's using different terms for these, but general, and probably on the right-hand side of broad, is the world of science fiction. It is autonomous thinking, autonomous reasoning. It's robotics. It's that. Now, I don't believe in my life we'll get there. I kind of hope we don't, to be absolutely honest with you. Where we are today is we're in the narrow space. So we're in the space where we do one task in one domain. So if you look at the narrow space, in most organizations we're doing that. So using an algorithm to actually look at a specific task, and it can't go outside of that task. Now, what people are working on is broad. Now, for the narrow one, you need lots and lots and lots of data. Because what it would be really good at is facial recognition software in an airport, as an example. That's really narrow AI that they use. But if you put a cat through there, it wouldn't know what it was. Because it's actually looking at human faces and mapping. It can't go outside its task. Now, broad AI is really the self-driving car that has many narrow functions that are connecting together. So it could be slowing the car down because the cameras have identified something else. It could be looking at the road traffic signs or the weather that's up and coming, or there's a car coming from a different direction. So it's looking at multiple different things. But again, what it's in essence doing is combining loads of narrow AI pieces together. And in essence, it's actually providing multitask, still in one domain though, because it's still a self-driving car. So that's where we're getting to, which is broad. But today, everything is, and narrow, don't think of narrow as negative, because narrow, you need lots and lots of data. The advantage with broad is you need less data, because you're connecting to more and more data points. So, these are the questions generally that we go into organizations asking. And to be honest, as the years have moved on, you cannot get to AI. I use this analogy a lot. You can't go from paper to AI. Most public sector hospitals in Europe, and I can only speak about my own patch right now, are still on paper. Now, I certainly know I worked in the NHS for 15 years, worked in medical imaging and in cardiology, and I still had paper-based records. And I go back to these organizations, and there's still a huge library of paper-based records. Now, that said, what they're trying to do is when they actually use that paper and they scan that paper, is lift the content and make some insights into the content. So most people know what data they have at their disposal. Most people can access it, normally from about 10 different screens at once, or opening a screen here and opening a screen there, which is the whole physician burnout that we heard about today. But do you know where the data is and how you access it is more to talk about a single point of access. So the last one really is the insights you want to drive. The biggest challenge we had seen today, we're doing lots of work in Dubai Health Authority, specifically around claims data. We're going to look at fraud, waste, and abuse next. And what they don't know is what insights they want. They don't know where to start. And part of the challenge is with AI is what do we do first? To be absolutely brutal about the honesty here, the thing you have to do first has to drive the greatest impact on the workflow of not just the people that work in your organization, but the consumers, if they're consumers, patients, if it's a provider organization, or citizens, if it's a government organization. It has to impact those end users. So I'll talk about in a second. I won't go through these because I'm going to make sure that we get plenty of time for talking. These have come up a lot. So why? Why is AI now? Why is there a need for it? We all know about the data explosion, but I think what we don't think about is the workflow, is the impact on the people that provide the care. The project I'm going to talk about in Switzerland that we've just agreed today is specifically focused on two things. Making sure the clinician has more time with the patient, but also looking at the diagnosis and the treatment. And the other thing that is focused on hugely is actually reducing the amount of time it takes to get a result. And I'll talk about how we've done that. But you can pick any of these right now, and you probably know them today. Some of the areas where we're seeing a large impact in AI is in imaging, purely because imaging is very data-driven. Again, my background being imaging, you can look at a medical image. It's made up of a number of grayscales. They're all data points. It's very easy to collect those data points and actually provide some insights. What's really complicated is to all the normal variants that we are as humans. We have lots of normal variants that we don't even know about until we have an X-ray or have a scan, and that's just normal for you. Your organs could be completely the reverse way around. That could be normal for you. So those normal variants is where AI needs more and more training. And also, the other thing that is making AI more complex when you talk about imaging is actually local data sets as opposed to global data sets. Because we focus very heavily on global data sets, but actually, if you look at breast imaging as a great example, breast tissue density varies from country to country, continent to continent. Therefore, if you're training a system on actually providing a report or a diagnostic outcome, it has to be based and trained on the data, clearly, that you have locally. So a lot of the work that's been going on in AI, people saying it's been slow, it's not been adopted, is training the system. It's training the system on the volumes of data that you'd want locally, but then you'd want access globally to the research that's available for you to actually provide some insights into that data, and I'll talk about that in a second. So examples. So today we not signed a contract, we announced our partnership with HUG, which is, for people that don't know, it's the Hospital University of Geneva. They have implemented and are using, with patients, Watson for Genomics. Watson for Genomics reads the panel, it provides a report, and also it checks the research using natural language that's out there globally, and also checks the clinical trials that are available for that patient, and it focuses on the genetic mutations of that specific tumor that patient's got. So it's personalized medicine. It's reduced the manual time it takes to read a small panel from 160 hours to 10 minutes. Now, immediately, that time means you're getting faster to actually providing a report. You're getting faster to matching them against the trial. You're getting faster to actually getting them through an MDT and getting them to treatment. So all of those things have the side benefits by just reducing the time it takes to actually analyze the data. Now, there's a press release out there. You can look at it. We've got a representative from HUG here as well, who's also talked about what they're doing. But the reason I bring that up is because it's in clinical practice now. This is live. It's being used on patients. They're providing them insights right now, and it's actually providing value to them. So talking about real-world evidence or real-world cases, that there is an example of what you can do using AI, using their workflow, but actually giving them access to more information is the key here, and access to relevant clinical trials is also very relevant. Life sciences, I won't go into too much detail on life sciences, but obviously we work heavily in clinical trials. I'm seeing lots of great applications in life sciences at the moment. I still think it's very untapped. I still think there's lots of work to be done. Everyone focuses on the data. If you look at even behind you, it's data, it's advancing medicine with research, it's insights into data. People are talking less about AI and more about data, because actually the curation of the data, which we talked about earlier, is a big part of the work which you have to normalize before you even get to being able to analyze. Government, lots of work going on in social program management. So social care, access to the citizens by using front-end AI technology for them to look at services. Great example is, I'm just checking, is that 5 minutes the end, or is that 5 minutes till time? I can't see anyone. Anyway, it doesn't matter. I'll keep going. So on social program management, you've got an example where you have a patient with Down syndrome. They want to access public services. They want to access a swimming pool at 2 o'clock in the afternoon, and it immediately looks at who they are, where they're from, what services are available to them. It matches it to what's the access for that person to get in there. The pool is quite quiet. So it's doing that all based on them, based on their information that's in the system, and it's all based on their personal care. So that's some stuff we're doing in social care. Imaging, I've just talked about. One of the greatest, I think, impacts in imaging is in volume studies, where you can use artificial intelligence to prioritize the workflow. Some people agree with it, some people don't, but radiologists that we've talked to believe there's huge benefit in the 30,000 mammograms they read per year to put the abnormal ones at the top first and read them. So you can look at workflow benefits in imaging to start with as a great place. Value-based care, we're doing a lot of work in population health management. I'm getting there. And then consumer health I just touched on. So, how much time have I got? A couple of minutes, great. Right, I'll skip that one. That's the problem, okay, that we're all trying to fix. These are all the pain points. And again, it's about opportunities that we have. Take a quick picture and then we'll move on to the next slide. So, I'll go on to a use case. Very quickly, I want to talk to you about Alder Hey Children's Hospital. So, they came to us a few years ago and they said, we want to reduce anxiety in our pediatrics, pre and post-operative care. We're seeing that children they're very anxious coming in. One of the great questions one of them had was, can I not just have an operation at night because then I can just go to sleep? So these are questions that they're gathering as information about when do they book the procedures. So what we did, built a small avatar. They can configure the avatar as they want. They can talk to the avatar and it will talk back to them. It uses natural language. It uses tone and sentiment to actually pick up on when they're anxious about certain things. They're asking questions like, when can I play football again? When do I have to go back to hospital again? And they take this avatar with them post-operatively as well. And this is just a very simple solution using artificial intelligence, which Alder Hey actually said has reduced the anxiety level of children coming in pre and post-operative now, because they've actually got a connection with the data, which is theirs personally. It's just a simple concept that people have gone the next level, and they put the iPad in a teddy bear, so they can take the teddy bear with them and they can talk to it and it talks back. If you ever remember that Furby that was around many years ago, that was just annoying. That thing just wouldn't shut up. So it wasn't a Furby, okay? So that's a great example of stuff we've done. I'm conscious that I don't want to run over because I know that everyone wants to get out. And I have got one more, which I won't talk about, but again, connecting the weather channel to smart inhalers. Again, very simple solution, using the weather channel. using AI technology and connecting smart inhalers to actually track how many times they're using it, to actually provide them insights into the air quality and how much use they should have the next day or the day before. So I will stop at that point.